Hi, everybody. Welcome to this very interesting podcast around mental health and neuropsychology. I have with me today a very accomplished expert in the field of neuropsychology and mental health, uh, Dr. Naren Rao. He's one of the directors of Manoshanti, one of the leading mental health clinics and hospitals in India. They've got around 9 centers all over, right from Pune, Bangalore, Mysore, Hubli, Dharwad, and I think rapidly expanding fast. So today, Dr. Naren is here for a very candid chat on everything around mental health. He will try and eradicate some of the stigma around it, go into more detail into kind of conditions, how they approach treatment, and lots of stuff. So, welcome, Dr. Naren. It's a pleasure to have you here today.
Thanks, Ketan. Thanks for having me here. Very happy to be here and discuss about the important issue. Yeah.
Wonderful. So, without taking further ado, let us get down to the bare knuckles. So, we would love to hear your journey, Dr. Naren. Just for the audience, if you can introduce yourself, a little bit about your background, your journey, what is your expertise. You've had around more than a decade, 2 decades of experience in this field. So, love to hear about that.
Yeah. So my journey in the mental health started when I was doing my MBBS. So initially when I joined MBBS, I joined with an aim to become an orthopedician. But once I started seeing the patients, I got fascinated with the psychiatry. Uh, Mind is the last frontier to conquer. So that is when I decided that I'm going to do psychiatry. So soon after my MBBS, I joined for MD at the National Institute of Health and Neurosciences, Bangalore, NIMS. And I worked there as a junior resident, got trained in clinical psychiatry, research, psychotherapy, and different patients, followed them up, got really trained well, and then worked there for 3 years. And then I went to Canada for doing my higher studies. I did a postdoctoral fellowship over there with an expertise in using the cutting edge technical tools, mainly the fMRI and positive emission. Then I came back, joined Indian Institute of Science for 2 years. I was a faculty there, working as an assistant professor, and did some clinical research identifying some newer molecules for the treatment of different conditions in psychiatry. Then I joined back NIMS, working there for the last 8 months, and became professor of psychiatry over there. The last 2 years, yes, 2023 is when I moved out of NIMS because I wanted to do something for the clinical work, develop an ecosystem where mental health is taken as a priority in the private healthcare system. So that is when I teamed up with two of my best friends, Dr. Dinesh Babu and Dr. Rishikesh, and then we started the Manoshanti. So I do have had a good run with clinical research, training, but my heart was in the clinical work. So that is when I decided that I would do this. And last 2 years we have been running the Manoshanti. It has been going well. So my interest is in using some of the advanced cutting edge technology in personalized medicine, personalized treatment for the patients. So core areas are depression, adult ADHD, obsessive compulsive disorder, mood disorders, dementia, interest. And we use several tools to do a comprehensive assessment, psychological, biological, genetic, imaging, and then come up with what's the best treatment process for improving health of people. So,
Wonderful. That's really a fascinating journey and a pretty long one
yeah,
too. So I think as a follow-up to that, you kind of touched based on that a little, but we would like to hear what really inspired you to choose mental health as your field. I mean, if you want to go a little more into detail, uh, you did cover it, but if you want to go a little more into really what, because it's become your passion and your
yes,
profession, right? And I would say that you've made your passion your profession. So really, what gets you going, and what is it that, and it's definitely not just obviously you're a professional, you want to have a good career there, but really,
yeah,
what keeps you going in that, and what made you choose it?
yeah, yeah. So in other words, what drives me every day to get up and go to the work, right? So that's the passion that's still there. Yeah. So the best part in my profession, I think, is I get to see individuals as individuals. Okay. So compared to many
Mhm.
other streams of medicine, so where we are dealing with the condition. Somebody has a liver problem, somebody has a kidney problem. Okay. But here, psychiatry is one field where I'm dealing with this person as a person. Okay. So I'm not dealing with somebody as one condition. So the main driving force to me is getting to know people, getting to know different facets of life, and also understand what is the reason that somebody is reacting in a particular way. Maybe what is there in this individual from a biological angle, what is there in this individual from a psychological angle, and also what is going on in the life now. Okay, so it is more like a detective work, okay, in psychiatry, that when we have to understand an individual. So I think my biggest reason to choose psychiatry was that, well, neuroscience is the last frontier. I think neuropsychiatry is what makes human beings human. So understanding human beings is what drives me into this field. Yeah.
Wonderful. I like what you said. Get to see individuals as individuals. I think I mean, very well put. I think that makes it pretty much clear. Uh, now, coming back to in terms of uh, what conditions do you primarily specialize in, and how would you describe your approach to treatment? Right now, you've told us about your passion. I think now let's get down to the nitty gritties of how do you really approach treatment, and what are your specialization?
Yeah.
Yeah.
So, uh, so the specialization is in the treatment of a few conditions. So I do have major interests and expertise in the treatment of mood disorders, so depression and bipolar disorder. The second one is the treatment of adult ADHD, cognitive issues in elderly, dementia, um, mild cognitive impairment, and I also have a lot of experience and expertise in the treatment of resistant conditions like schizophrenia. So, done a lot of research in individuals with psychosis. So these are my major interests.
Awesome. Now, coming back to you know how do you balance? One of the interesting things that I've been hearing is that while obviously it's important to diagnose the patient based on clinical parameters, but in this field it's also important that you have very compassionate care. You've got to take care of that as well. It's because you, as you said, right? It's not just a patient but an individual that you're looking after. So, how do you balance both aspects of it? Your evidence-based medicine with compassionate care.
Yeah. So I think there is something common across people. So, for example, if there are 100 people with depression. There is something common across people, but there is also something that is unique to each individual. So
Hmm.
what the evidence base tells us is what is that common thing that becomes better, but it doesn't tell us what is that unique thing which is important for this particular individual. So that is where the empathy and compassionate care becomes important, because while evidence is important to understand what works in everybody, it is also very important to understand what is that which is very important and it's critical for this individual person. Right? So I think when we are treating a patient, we have to combine both these things. So it is understanding what works in everybody will also work with this person. But at the same time, it is also very important to understand that why this person is having this condition now. So why now and why this individual? So unless we target these two things, the treatment is incomplete. While medications and therapy, what we practice are evidence based, it is very important to individualize that treatment, both in terms of what is the side effect of the medication, what is the effect of the medication, which kind of psychotherapy is something that is important for this person, which kind of psychotherapy is very likely to give the best benefits and a long lasting benefit. Okay. So that is where I think an amalgamation of both the evidence base and a compassionate care comes into the picture. So that is why in Manoshanti, what we believe is an empathic care. So the empathy is the cornerstone where we bring the scientific evidence, but the compassionate care and the empathy takes the forefront in the care.
Okay. That's wonderful. So now that we have that you have kind of shed light on Manushanti's approach, let's go a little deeper and bigger in terms of Manushanti as a whole, right? So what do you believe makes Manushanti unique among your competitors or others in this ecosystem? There are a lot of other players also which offer the same, and it's and each of them have their own unique. But what makes Manushanti unique? And what differentiators do you personally see in day-to-day practice? So we would like to hear in terms of, actually in terms of practice. We've spoken about the ethos, the approach, and the methodology, but let's go down to the day-to-day operational aspect of how do you actually put that in
Yeah.
practice.
So a lot of thought has gone into it when we started the whole thing. So what we believe is the treatment has to be holistic and very individualized. So that's the major approach in Manoshanti. So we don't believe in treating everybody as the same. So like I mentioned, it is very, very individualized treatment, but at the same time it is also holistic. So we don't believe only in one form of treatment. So it is a comprehensive evaluation, because um, what we have realized is many of the psychiatric conditions, psychological difficulties, what we usually call them, is actually a biopsychosocial problem. So there is an underlying biological problem in some individuals. Some individuals it is a psychological issue, in some individuals it is a social issue. So the first step is a comprehensive understanding of all these factors. Because for some it may be a hormonal issue which is triggering the mood disorder. For some it may be the childhood trauma which is getting revisited, which will be resulting in a mood problem. For some it could be a relationship breakup or a financial difficulty which is resulting in a mood condition. Right? So if we don't do a comprehensive evaluation and understand everything, we are going to treat everybody as the same. So which is not going to work, because it has to be made personalized for them to be very effective. So it's like a saying that if hammer is the only tool that we have, all our problems look like nails. So we keep on hitting the same thing. So that's not what we want to do and what we are doing. So what we do is a comprehensive evaluation, so that initially we understand the individual very well. So we do a lot of psychological assessment, we do the relevant investigation, take a detailed history of the person for the current condition, about the past, about the family. So once we have a picture, so it is more like a movie that we build, okay, in our mind. So we have a continuous picture of which helps us to understand why this individual is going, what is going through the current phase, and why this kind of a reaction. So what is the trigger and why this kind of a reaction? And based on that, our treatments are also both while it is evidence based, it is also a host of choices that we have. So for some it may be medication, for some it may be therapy. We also have very advanced treatments like magnetic stimulation. So we combine many of these treatments together, and our whole goal is to handhold the patient and reach them to the other side where they could actually live their life on their own. So that's the three words that we have in Manoshanti. So our care is empathic, and at the same time it is very, very scientifically backed, evidence based, and only relevant. So that is where the ethical practice comes. And our aim is to make the individual enabling in their own self. That is, they have to lead their way on their own. So our approach is to make them independent, to make them to handle their issues. So it is not to make them dependent on us for the continued care.
I think that's pretty detailed, and I think that's important in understanding how do you actually, like I said, put that into practice, right? I think that's important. You need to walk the talk in terms of what your approach is. So I think that's very unique and very refreshing to hear. So, what do you think prospective patients, appreciate the most about your team and environment? And how do you train your teams also to follow the same?
So the staff team members are very carefully chosen. So
Hmm.
like I mentioned, me, all the co-founders and the majority of our staff are trained from Enhance, which is the premier institute in India. And our staff come from very highly reputed institutes across India. Okay, so in addition to the demands they come. So the first and foremost, the people who get into Manushanti, they have a very good track record. So we ensure that we have people who are very good in what they do. So the quality is assured. And there is a continued measurement of the quality, both in terms of quality of care as well as listening to the patients and also making sure that the treatment is progressing in a way that the patient and the doctor has envisioned. So we have several layers of quality check. For example, if somebody is undergoing a magnetic stimulation, so we do a structured assessment at the baseline and at every 10 sessions to see that whether somebody is improving. If they are not improving, we have a team meeting in which the details are completely reanalyzed so that we look into why this person is not responding, what is that which needs to be done. And it is very similar when it comes to psychotherapy or when it comes to the consultations that happen in Malaysia. So we have a very rigorous ongoing training activity. We have a rigorous continued medical education, which is an arm which we call it as Jignasa, that is the clinical curiosity. So we have invited lectures in that. So we get people both from Manoshanti and outside come and speak, and we also do a lot of continued medical education programs so that we are updating our staff on a very, very regular basis. Patients who they have the expertise, all
Got it. Uh, so coming back to back to the patient, right? If somebody is a prospective patient who would like to, I mean, taking the first step itself is very big. So what can a patient expect in their first session with you?
so
And secondly, how do you also take their family or friends into confidence, because that's also a very important part of it, because I think it's a, as you mentioned, social, it has a social underlying cause also, and I think that that's as important as the individual treatment that is given. So what can they expect, and how do you kind of and what is the role of the close family and friends in this as well?
So usually when the prospective patient makes the first contact, so what we do is a detailed clinical evaluation. This is usually done by an experienced psychiatrist who can see the different facets and then decide which is the angle. And also we do make sure that whenever the patient is accompanied by either a friend or a family member, relative, so we do speak to them, we do educate them, we do get their point of view. And it is very, very important to understand in the Indian context the dynamics between within the family, and also the support structure which is usually from the family in a good majority of the individuals. So it is very important to strengthen and involve that family in the care, especially when it comes to the children and the elderly. The family is the major source of both support and care. So it is very, very important that we address the concerns of the family members. So we do spend a good amount of time in first understanding both the patient and the family member. So once that is done, we do a psychological assessment to deep dive into the individual, to understand their thinking pattern, to understand their emotional attachment styles. We also do assessments to understand the severity of the current condition, and do, whenever required, do relevant investigations to see whether there are any other contributory factors. So once we do this initial assessment, then we sit with the patient and the family and then discuss about all the available treatment options. Because it is a journey that is in which both the doctor and the patient are traveling together. So it can't be dictated in a one way, because unless the patient is involved in the treatment process, the treatment is not going to be complete. And it is very important that we take the patient's viewpoint into consideration, because some of them may have a particular preference for a medication or a side effect that is non-negotiable with them. Some of them may want a particular type of it. For example, somebody may want to try only the psychotherapy, or somebody may want to try only the magnetic stimulation without the medication. So we do respect those. So once we start that, then the next phase starts. Then we review together and then decide how to go about further.
Um, just to add on to that, do you find yourself in a position where you have to debunk any myths or any misconceptions around both for the prospective patient and the family as well, in your conversations that you have with them,
Yes.
and what kind of myths do you generally
Yeah.
encounter?
Yeah. Unfortunately, that is one of the major work that we do in the beginning of the thing, because in spite of so much of information available, still there are a lot of myths. So the major myths that we work are: one, all psychiatric conditions are going to be lifelong. That's the biggest myth everybody is working. Once we start a treatment, the treatment goes on for lifelong, which is absolutely not true. It is a short-lasting treatment. It's as simple as any other condition which comes and goes. Good majority of people. So one of the major concern that people have is if I start the treatment, it is not going to end. So that is one major thing we have to work on it. Because usually the treatment for first episode of depression or anxiety is for 2 to 6 months, not more than that. The second myth is that all medications used in psychiatry are addictive. So that is another biggest myth, that I will become dependent on the medicine. I will not be able to come out of the medicine, which again is not true, because the medicines are safe. medicines can be stopped. There is a process which we have to go through. The other myth, which also many people do have even now, is that the conditions are sometimes people do come with explanation which is very unique, maybe rooted in some of the supernatural causes. So many psychiatric conditions are due to several reasons, which are psychological or biological, like any other illness. And they have effective treatment. So these are the common myths which we have to burst in the beginning. So informing them what is the nature of the condition, caused this condition, and also like what are the treatment options. And the therapy part, when it comes, many people do have a belief that the therapy is going to be hypnosis, where I am going to be a passive person, which is not the evidence-based therapy that we practice. So, because what we practice is a very conscious, interactive therapy techniques, which are targeted and time-bound. So, usually our sessions are 20 sessions. So, last for around 3 to 4 months time. So that's again another myth that we usually have to address in people. Yeah.
Okay, great. I think so. Uh, Now, I think we've covered a lot on, how do you approach treatment, what do you take care of, the compassionate care part, evidence-based diagnosis, and, you covered the process of end to end. Now, but I think the first step is the big step, right? I think somebody taking, like we discussed earlier, somebody taking that first step itself is honestly the biggest thing. So, what advice you would give to someone who is seeking professional help, and what are the signs that you think that somebody should actually consider, where it says, okay, it's just not a headache, or it's just not, I'm not feeling well, right? Beyond that, something deeper when you seek help. So what is your advice for
Yeah, yeah,
somebody?
yeah. I think it's an excellent question, because many times people do come, and then it takes a while to explain them how a common sadness is different in a depression. Right? So I think some of the warning signs that the individual has to remember is if there is a mood change that is continuous, I'm not feeling good, okay, whether it is with reason or without a reason. I'm not feeling good for a long time. So when I say long, it might be for a week or two, that I'm continuously not feeling good. I'm not able to sleep well. So that's one major warning sign that I don't have any problem, people say, but not sleeping well. That's the first sign that it's popping up, that it's not, things are not going good. Some people say that, doctor, I'm having everything, but somehow I feel that all these things are meaningless. I don't get the same kind of pleasure that I used to be. I'm not having the same kind of a josh that I used to have, the zeal in the work or in the family or in the interactions. Sometimes it is also noticed by others that you seem to be lost, right? So that is, in some individuals, when they have, for example, adult ADHD, okay, so many times it is misdiagnosed, not diagnosed. People are
Hmm.
not aware that such a condition exists. And, you may simply think that this person is very impulsive, this person is not able to sustain interest, is getting bored very easily. And this has been a pattern that it is difficult to stay in a defined place for a long time. So these are some of the signs that we see. So it may be a biological sign, like not sleeping well, not feeling like doing anything, feeling very weak, or it may be a psychological thing, like I'm not getting the pleasure, I'm feeling continuously low, or sometimes it may be a feeling of overwhelming that I'm not able to handle. I know that it is too much for me to handle, and I can't identify why am I feeling like that. That's the sign of the anxiety. And there are some people in elderly may come up with forgetfulness, because commonly elderly individuals think that forgetfulness is part of the aging. which again is not true because some amount of forgetfulness here and there may happen, but I'm not able to remember more frequently and forgetting things. I keep things and then I'm searching for it again and again. There are signs of a need for further care.
Got it. Yeah, I think that's a very fundamentally important question, and like I said, you I think mentioned very important points that what you think could be just a simple case of not feeling well or just down, mood, some mood is down. You need to really understand what could be underlying. So I think you kind of hit the nail on the head. I think it's and do you have any checklist or something which not a checklist as such, but what are the where you can probably, especially for the uh, near and dear ones who are actually bearing the brunt or seeing the person. Sometimes the person doesn't realize it, right? But the others who are seeing them will actually feel because they are experiencing the behavior or change of it or lack of it. So any signs or like a small checklist or anything says that this is how you if you see these conditions, please seek help.
Yeah. So say there are few things which maybe which an individual can take on their own, which are there in our website. But there are also some checklist like you asked. Okay, so let me give you a practical example. For example, a manager is noticing that somebody who was very interested in the work, was very committed, top performer. Suddenly there is a dip, seems to be lost, not interested, not able to deliver, and also gets irritated very easily, snaps out things, misses attending the work regularly. So, so this, for example, may be a sign of depression. But many times, rather than being identifying it as this may be a condition, because it's very important to recognize that a disciplinary nature is many times taken, right? So, because mental health conditions, unlike physical health conditions, are not visible to others, it is something that one has to be very careful in identifying. So some simple steps could be that there is a sudden change in the behavior. So be it somebody who was very jovial, outgoing, center of attraction is suddenly silent, or somebody who was able to focus very easily in the work, do the work very easily, is finding it very difficult to focus in the work. Somebody who was interested and full of energy feels that things are not looking similar, not feeling interested, or feeling very weak, not feel rested after getting up in the morning, don't feel like doing things. So these are some things either an individual themselves or somebody who's their near and dear ones can identify, and then may suggest the person, because many times the individual themselves may not be able to recognize what is going on. It's like we can't scratch our back very easily. So we need someone else to point where is the blind spot. So, so we may need someone else sometimes to show us the blind spot.
Got it. I think yes, that's it keeps on coming to just being very aware of yourself and also nearby keeping a watch. It's very easy to just brush it under the carpet as you're going through a bad phase or just a physical condition. So I think you really bring very important points. Now, now, now that we have identified and covered the entire end-to-end journey from how do we identify a problem to diagnosis to how you take care of it, everything, uh, what what are the kind of conditions that you commonly see in your clinic, in your experience? What are and especially in our country, which is a little culturally a little different from the Western world, you as so common conditions that you see, maybe if you I'm not asking you to rank them, but what are the general and what are you seeing as an increasing trend in the last few years, especially post COVID as well, because COVID was tough for pretty much everybody. So yeah, and also in terms of urban and rural, semi-urban, what is the difference in the kind of profile of prospective patients that you see?
Yeah. So I think you have brought very important topics. First one is the common condition, but also the rural and the urban divide.
Mm. Mm. Mm.
So depression and anxiety continues to be the most common condition as it's also changing social structures, increasing stress levels across generations, poor social support, time management is a major concern. Right? So depression and anxiety, obsessive compulsive disorder, where people are doing things again and again, checking things, washing their hands. Screen addiction. Now that you mentioned what is after the COVID, so screen addiction, be it mobile addiction, internet addiction, gaming. So that is another thing that we are seeing on the rise. Adult ADHD is again important. In children, we see very commonly the autism and the ADHD spectrum. When undergoing adolescents with adjustment issues, be it in the school, relationship issues, mobile addiction in the adolescents, and in adults, in addition to all these conditions, we also see many of them having alcohol and smoking addiction. Uh, and in the elderly, nowadays, it is becoming more and more common to see people having early stages of memory issues, maybe an early stage of dementia or a pre-dementia stage, and also depression in elderly. So these are some of the common conditions that we are seeing in the metropolitan cities, the urban. In the rural, the is similar, but we do see a different pattern of presentation. Many times we see, in addition to the mood disorders, alcohol use is high, and they may also be having many times some pain in the body as the major presenting complaint. So it's called somatoform. What may be presenting as a mood issue in the urban should be presented as somatoform disorder in rural. So what we are also seeing of late is the division between urban and rural are getting blurred. So you see a lot of them with mobile addiction in the rural. You see a good majority of individuals presenting with cognitive issues in the rural. Uh, but nonetheless, the prevalence is more in the urban.
Okay. Okay. Uh, yeah, I mean, I think just a quick question follow up, and maybe you can give me a simple answer. Do you see the current generation, right, what we call as Gen Z? Do you see them a little more? I mean, it's a generation that is born on the internet, social media, and that brings in multiple layers. It has its pros and cons, of course, but do you see that this generation is firstly uh, more susceptible or more likely to, you know, have mental health issues, and secondly, also are they more likely to seek help as well because yeah, it's a generation a little more aware of their rights and what they want than maybe the previous generations.
I think I think the Gen Z have their own strength. They use the technology much better than the previous generations because they're born with that, like you mentioned. But I think
Okay.
one susceptibility is when the Gen Z reaches their adulthood, suddenly the, the the world that was there in the virtual and what is there in the real is very different. So the resilience becomes an issue there because this is a generation which had a lot of things in the virtual world. Uh,
Mm.
so I think that may be one of the reason that uh, maybe a little higher proportion of Gen Z compared to the millennials or any previous generation present with the mental health condition. But also, the good part in Gen Z is there is no stigma in approaching for the mental health treatment. They are
True.
seeking treatment much more openly because they don't see a difference between seeking for a physical health versus seeking for their own emotional well-being. I think that's a good sign that the Gen Z is seeking the treatment, and that may also manifest as if the prevalence in Gen Z is more because in the previous generations, the help-seeking behavior is also not as good as in the Gen Z. So it may be a combination of both these factors. I think.
Okay. Yeah, I think I just have one last question, really, in terms of, you know, uh, what would you know, what advice or what are the precautions you would give anybody, just across any generation, any age, or any, income group, social strata, doesn't matter. What are the, things that we live in a stressful world. I mean,
Yeah.
it's sometimes it's choice, sometimes it's just the way you are. I mean, it isn't. So, what would you give advice in terms of how to take care of your mental health? And second, with AI, I mean, you could pretty much diagnose everything on ChatGPT or Google it. A lot of people do self-diagnosis and all. So, what is the advice for? What would you say? Is that a good thing, or would you advise against it? So, yeah, a couple of questions closely
Yeah.
related.
So I think like you mentioned, we live in a we live in a time where stress is part of our life. So everybody tells decrease stress. Nobody knows how to decrease
Yeah,
the stress. So I do think
true.
it is important to deal with the stress because decreasing
Yeah.
stress is not in our hand. We need to be equipped enough to understand where is my limit, how much stress I can take, and how do I deal with the stress when it is crossing that threshold, right? Uh, I think it's important for each person to understand their body and the mind and then design their work-life balance accordingly. So what works for somebody may not work for me, right? So that is the first distinction to understand. Because I see that many people trying to do because it happened to somebody else, it worked for someone else. So while it's perfectly understandable, but it may not be the case. So each one has to understand what works for them. It's important to have a structure, a little routine in life, because every day need to be a little more predictable to decrease the stress. So sleep hygiene is extremely important. Spending some quality time with the dear one is very, very critical. Because in this busy life, where time is not sufficient, we are always running behind performance, but not on a relaxed, interpersonal, meaningful interactions. Because human bond is extremely important for one's emotional well-being. So I always suggest people that at least for 30 minutes in a day, do something that is non-productive but which makes you happy. Yes, I think we have lost that taking things slowly approach. We have lost that approach. Because we are always looking at okay, if I spend my 30 minutes, look at it as an investment of to get back the return. But I think it is important to invest our time for our own emotional future. So I see many people starting to play badminton uh, for recreation, and in 2 to 3 weeks they are into full amount of stress because someone else is playing better than me, and I need to win. Right? So that's where I see that don't get into the performance in each and every activity. Do few things just for your own enjoyment, pleasure, recreation. Because we are not designed to be on the go 24/7. Our brains are not designed, our body is not designed for that. Chronic continuous work is the major reason for many of the stressful conditions. So I think important to have a balance and important to rest adequately and also know where the limit is in terms of the stress and deal the stress in a proper way. When it comes to AI, I think AI is revolutionized. AI never contradicts you. But unfortunately, that's not how the human mind works. Because if you are only listening to what you want to listen, which AI gives, many times we get into that loop of self-fulfilling prophecy, right? So which is not good. So that is where I think it's important to recognize that AI is a good step to understand what I'm going through, but don't take AI as a treatment, because sometimes you may need someone else who is going to tell you in a friendly way that where something is going wrong, which AI cannot do. So I think we may have to wait for some more time before one uses AI for treatment. But to understand what they are going through, whether it is something that they need to seek treatment or whether it is something that is part of the natural life, day-to-day life stress, I think AI is very good in telling that whether somebody is, needs treatment, who to approach, where to approach. That part AI is good. But I think we need to be very careful because I know some people use AI for treatment, and then they are chatting with GPT for hours together, and then sometimes it is a spiraling loop. But unfortunately, not spiral upwards, but a spiral downwards.
Right. I think, it's 100% right. I think that, it's the solutions are simple, right? I mean, it all comes down to very simple, basic things that some even you're aware of, but it's so difficult to put in practice. And I think that's always, important. And I think it's a separate discussion itself, stress in AI. I think it's a very interesting topic because AI now, people will be dependent on AI. We talk about AI bots and AI avatars. It's a separate discussion, of course. Not for some time later, I would say. But I think this was great, Dr. Naren. I think it's really good insights, and you were very candid and very detailed and very open about sharing your experiences. And I think your expertise is definitely going to add value. Thank you very much for your time. We really appreciate it. Uh,
Thank you.
Goodbye.
Yeah, yeah. Thanks, Ketan. It was very good chatting with you. Yeah. Thank you. Look forward to
Thank
further
you.
interactions. Yeah. Bye.
Thank you. Take care. Bye.